as you're no doubt aware, the partnership is a dark money lobbying organization that its whole purpose is defeating not just Medicare for all, but really any coverage, public coverage expansion. And so last year, medical students sort of within the inside of the AMA launched a resolution in the House of Delegates to have the AMA walk away from its longstanding opposition to Medicare for all. At the same time, they and we had a rally outside the AMA. Many of us spoke. It was a really exciting moment. And the vote in the House of Delegates narrowly failed, but it was quite narrow and it was carried by news organizations. And I think about a few weeks later, I want to say, the AMA did withdraw from the Partnership for America's Healthcare Future, which again has made some headlines. And was an important win. So when we were sort of thinking about how do we proceed this year, do we continue to sort of put pressure in that area, we thought that we'd already had some kind of success with the AMA, and that it was time to move on and to try other approaches. So as you're probably aware, the American Hospital Association is one of two major lobbying organizations of hospitals in the United States. The AHA represents community hospitals. There's also the Federation of America's Hospitals, the FAH, which represents for-profit hospitals. But what we were really, what we really had in mind was the following. The AHA, unlike the AMA, remains in the Partnership for America's Healthcare Future. In the last year, there have been numerous news reports of hospitals suing patients for unpaid medical bills, taking them to court, actually garnishing wages, including of their own employees who came back to the hospital for care. There have been other reports of patients actually having their home foreclosed because of these legal proceedings. And so that is an issue, and that's something that I think has generated rightfully a lot of outrage. We felt that it's really time that we demand that America's hospitals and the AHA as their organization condemn this practice and no longer engage in it. And this sort of took on particular salience in the context of the COVID-19 pandemic, where people may wind up, hospitalized with COVID-19, who are uninsured and underinsured and wind up with large hospital bills. So there have been some legal, there was a law passed that will provide some protection to uninsured patients. And some insurance plans have said they're not going to impose copays on patients who are admitted for COVID-19 related care. But obviously, COVID-19 is only one reason to be hospitalized, and these protections are inadequate. And so we felt that it was particularly important to demand that America's hospitals and the AHA as their representative condemn the act of suing patients for unpaid medical bills, including for COVID-19, but not only for COVID-19. The second issue, though, is the question of the AHA's continued membership in the Partnership for America's Healthcare Future. Keep in mind that the partnership was originated as a lobbying group for insurers and pharmaceutical companies, the bad guys. And it really is unbecoming for medical groups to sort of take part in this. As I mentioned, the AMA left. Actually, we've learned that more recently, the remaining physicians group in the partnership has also left, the American College of Radiology, again, under pressure from members of PNPH. So that really leaves the Hospital Association. And, at this time in which many hospitals are actually struggling financially, laying off hospital workers, cutting pay for hospital workers, there's discussion of hospitals having to close as, under the financial strains of the epidemic, under the financial strains of the coming recession. At a time in which those resources are particularly strained, in which hospitals need every resource they can have, what sense does it make that their organization is using their funds in order to finance and fund this dark money lobbying group, the Partnership for America's Healthcare Future? So obviously, at any moment, we'd be pushing the AHA to withdraw from this organization. But we think at this moment, more than ever, it's particularly wrong to be participating. So the campaign is designed to achieve two goals. One, to call out the AHA for condoning the practice of lawsuits against patients, including for COVID-19, and two, to call on the AHA and its member hospitals to withdraw from any participation or contributions to the Partnership for America's Healthcare Future, which again is particularly important at this time of increased need. And given the pressure that has been placed upon America's hospitals in light of a lot of the reporting about some of these egregious practices, we think this is a winnable campaign. We think that it will potentially be of interest to the media, certainly to the public, and that it fits very much into people's concerns and policy issues moving forward in the COVID-19 epidemic.